The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead. We provide programs and services designed to assist and support the older town residents who wish to remain in their homes as they age. If we don't currently provide a service, we will try and connect you to that service. Call 311 or 869-6311 to get more information or receive services.
Welcome to Project Independence and You.
And welcome to Project Independence and You Community Talk Radio. I am Kristina Liu, your producer, but today I'm wearing the host hat, and I'm here with our fabulous co-host, Otto, Lohse. And today we will be interviewing Maura Calio, who is a community health educator over at DeMatteis Center at St. Francis Hospital. Maura is an old friend of the show, so she's a pro at this. And of course, you could see, if you're going to watch us on North Hempstead TV, but if you were listening, everyone has little hints of red in their boxes because it is February, and that means it is Heart Health Month. So we're going to dive into that because it's certainly an important topic and a complex topic. So welcome, Maura.
Hi. Nice to be here. Good.
Now, obviously, everyone always sees, for February about Heart Health Month and the importance, but just give us, why Heart Health Month is February and what the focus is and whatnot.
The American Heart Association highlights heart health in February to make sure that people are aware that heart disease is still the number one killer of men and women. There's another event that takes place in February specifically dedicated to heart health in women as part of the bigger umbrella of National Heart Month, and that's Go Red for Women. That was February 5th. And just a little sidebar about that is that the perception is still largely that heart disease is a disease that men experience and that women are most afraid of breast cancer, which is absolutely something that they should be knowledgeable about and aware of. But that many more women suffer heart problems than those who suffer from diagnosis of breast cancer.
Wow.
So the overall picture is that the more awareness that we can have for men and women, the better. For seniors, it's often about understanding why you're prescribed certain medications, why your doctor asks you to do certain things, how to maintain the health that you have, which can be very challenging as we age, and also to be very cognizant of symptoms when something's going wrong.
Absolutely.
One of the things that kind of a basic maybe, but I think seniors are very concerned about having a stroke.
Yep.
I think, and I unfortunately know a few people right now who are going through the stroke situation, and
Yes.
it's very debilitating or can be. Just explain a little bit briefly the difference between a heart attack and a stroke.
Sure. It actually is a topic that's very close to me because I'm also the facilitator of the stroke support group at the DeMatteis Center. So over the past 5 years, I've really come to see the effects that stroke can have, not just on the person, the survivor, but on the person who becomes the caretaker in many situations, oftentimes the spouse. And meanwhile, both are aging. So it can be very difficult. So when someone has a heart attack, it most often results from a blockage in an artery that supplies the heart muscle. It's very similar in most cases to someone who has a stroke, where they will have gradual narrowing of some of the vital blood vessels that feed the brain. Most strokes have to do with that kind of disease where the arteries become blocked. A small percentage of people have a stroke that's called a hemorrhagic stroke, where a blood vessel will rupture due to some kind of weakness. Sometimes a person has an aneurysm. and that ruptures. That's a weakness in the blood vessel, or another unusual feature. It's not that common, called arteriovenous malformation, where it's just a little jumble of arteries and veins, and those are weak vessels that can rupture. One of the biggest contributors to the hemorrhagic strokes is high blood pressure over a period of years. The same risk factors that put somebody at risk for the other kind of stroke that's called an ischemic stroke, or a stroke where the blood is not getting to vital areas of the brain, causing death to some of the tissue, is the same disease process that can lead to heart attacks. So later we can talk about risk factors and what people can understand about why they might be on so many of these medications. It's often to reduce the risk of having a heart attack or having a stroke.
So is there like any, I'm sure we're going to get into more like about how to help prevent a stroke, although I don't know if there's such a magic answer that you can guarantee that. Or also, is there, as you're going through physical examinations and whatnot with doctors, ways that they can detect that you may be a candidate for a stroke or a heart attack, so that it's done ahead of time, so that you don't end up going, having one of these events, and maybe you could have done something to help not have that happen.
Right. The more classic type of stroke that I'm talking about, where an artery gets blocked, the things that are done to reduce a person's risk are to keep very, very good control of blood pressure. That's one of the biggest issues when we see people who've had a stroke. One of the biggest reasons why they may have a second stroke is because the risk factors are not under good control. Maybe they're eating too much salt in their diet, or not taking their blood pressure medication as they should be, or they don't go back to have the blood pressure checked. So definite control of blood pressure, control of cholesterol levels, the fatty substances in the blood that many people, when you go to a doctor, they basically do an assessment of your risk factors. And the person that has multiple risk factors needs more aggressive treatment. So if you have diabetes, high blood pressure, high cholesterol, all of those things need to be managed to reduce your overall risk. When someone has had a stroke, it used to be, I'm a nurse a long time. It used to be not too much we can do. Okay, it's already happened. Nowadays, they look for a clear understanding of why the person had the stroke. Sometimes it's hard to discover, but there's much more aggressive kind of detective work done now than there used to be. Sometimes people will have a stroke and they don't really know why, and they'll do certain tests to kind of investigate. Oftentimes, a stroke that happens for no apparent reason can be the result of unidentified heart rhythm problems, so that they will then put in a device. It's called a loop recorder. That's a tiny little device that goes under the skin, and it records the heart rhythm. So this is all part of the detective work, that if they can catch some of these difficult, unusual rhythms that promote clotting and sending a clot to the brain, they know what to do to try to prevent it from happening again. Or if somebody's having symptoms of these rhythms coming and going, the best case scenario is to prevent the stroke in the first place. So that's,
I went on my own about 25, 30 years ago to the DeMatteis Center for what was, I think it was called an ultra fast CAT scan. And I found out as a result of that, which I did on my own, that I had a high calcium score.
yes.
So I spoke to the doctor that we mentioned before the show, and they started then to put me on a much more aggressive plan as far as cholesterol and blood pressure is concerned. But I don't hear that word very often. Is it still something that is done
It's just called a different name. If someone has especially a cluster of risks, with no symptoms, okay, this is not the person who has symptoms of heart disease, they can go for what's called a calcium score. And it's a very brief CAT scan, because the CAT scan is very fast and it will pick up a score similar to what you're saying. And the level of the calcium score correlates with the degree of buildup in the arteries. If there's more suspicion that something is wrong, they can do the next step, which is a CT angiogram, which is much more thorough. And that might be for somebody who they kind of have symptoms, but it's not too clear cut and they want more information instead of going to a more invasive test that obviously carries some risk. So it's a very low risk test, but the ultra fast CT scan is now called a CT angiogram.
Okay. Now, I did that on my own accord. I can't remember why. There was some article
They were
somewhere.
doing a study at the time. I remember.
Yeah.
Yeah.
Well, frankly, it was fortunate that I did it. I had no symptoms, and it looked like a good idea. My mother had a stroke a long time ago.
Yeah.
The one thing I did learn is that you can't change that. If you have a lot of calcium, no matter what medication you take, it's there, as I understand it, unless that's changed in the last 25 years.
They do some procedures where there's blockage to try and remove some of that plaque, but more often, if somebody has narrowing, say of a coronary artery that's 70% or more, they will attempt to put in a stent. And the stent is it's like a little spring, and it's collapsed when they put it in during a catheterization. And then it pushes back the plaque to open up the lumen, the opening in the artery, to allow more blood to get there. And that's done very, very frequently. That's the best case scenario. If somebody has multiple areas of blockage, they may require bypass surgery, where they use the vein or an artery in the chest to bypass and bring blood supply around the kind of the plumbing problem and supply the heart muscle, so that the heart muscle is not damaged irreparably.
It's interesting you used the word a plumbing problem. There's another word that I hear that I think is like a big mystery, the electrical system.
Okay.
I had a good friend of mine that kept telling him it was the electrical system. And I'm thinking, so it's the electrical system.
Right.
What's that all about?
Okay. Simply put, your heart has very specialized muscle fibers that conduct electricity. So if you didn't have an electrical system, your heart wouldn't beat. To keep beating, 60 times a minute or 80 times a minute, there's a pathway that begins in the top of the heart and travels along a little fiber down to the bottom of the heart. You know how the heart beats the top, then the bottom, lub-dub. You hear the heart sounds. It's a smoothly operating system. There are things that can go wrong with the electricity that require different testing than would be required with a blockage or a plumbing problem. Okay. So there are specialist electrophysiologists that can do testing to see where the problems are. And there's many different kinds of issues that can come up. Most often in seniors is something called atrial fibrillation, which many people probably know as AFib. And in short, that means that first little node in the top of the heart that begins the electrical, the beat, the conduction, every time the heart beats, has gotten a little tired. And what happens then is other fibers in the top of the heart compete to say, I'll take over, I'll take over, I'll take over, so that the coordination between the top and the bottom of the heart is lost. The bottom keeps beating, the top keeps beating, but they're not in sync with each other, so that the heart doesn't get nice, smooth contractions to pump out blood. It's more of a quiver. So it's not as efficient. when that happens, the blood that's in the heart kind of pools a little bit more. It's not like it's pumped out briskly. And when any time that blood is a little more stagnant is a scenario where it can develop clots. So that's why when people have atrial fibrillation and they've taken measures to try to get the person back into a normal rhythm, some people live with AFib, but some of those people are on aspirin, blood thinners, really to reduce the risk of stroke.
Did they end up with, I'm sorry.
No, it's okay. I don't, you can finish. I was just thinking, like you hear all these things, and obviously our show is largely, and Project Independence is always about kind of preventing, these issues. So like, how would someone even begin? At what age should you really be getting these things checked out? Or, I think a lot of it is something hereditary, so how would you like even go about like just getting ahead of this before it's an issue? Ahead
of any cardiac issues?
Yeah, like just giving your best option, and just knowing what, as Otto said, he just went for a test, and he didn't feel any symptoms or anything.
Yeah. Nowadays, really having your physicals and coming back when the doctor asks you to is really important. You may not know, you should ask, why do I need to come back? It would be to check your blood pressure, to check to an EKG. An EKG would identify any abnormal rhythm. Some people also experience palpitations. If they suddenly go into AFib, they may feel their heart racing, something that has to get checked out. So when you go for your annual physical, particularly as you are 50, 60, these are things that definitely once a year, your blood work, the blood tests that are done are tests for cholesterol, tests to screen for diabetes. Diabetes, again, we also have a program at DeMatteis that's a whole year program for people who have pre-diabetes, because there are 86 million people in the country who have pre-diabetes. They're at risk for the same complications as people who have diabetes, and that is a greatly increased risk of heart disease. I think yes,
well, so that's a good way. Yeah, we're going to continue.
I can pick up with that.
Absolutely.
After.
So anyone that is listening, tune back on to Project Independence and You on Community Talk Radio on 80.1 FM and WCWP.org. We will be back with more Calio after the break.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
And welcome back to Project Independence and You, Community Talk Radio, here on 80.1 FM and WCWP.org. I'm Kristina Liu, and I'm with Otto Lohse, and we are talking with Maura Calio on all things for Heart Health Month, and it certainly seems like a lot of things are interconnected. So we're just trying to get to the bottom of how to kind of prevent it, or if you have some heart disease, how to control it. So before the break, Maura, we were kind of talking about where you begin when you're at the doctor, different things you do. You had mentioned about the physical and how important that is in getting your blood work. And I think, when you hear these things, is heart disease something that's hereditary?
Oftentimes it is. And that's part of a good health history that your doctor would take when they first meet you, would be to ask about particularly people in your family, parents and siblings who have problems with their heart. You see it run in families. And it's important to know about, because that might be a person that has risk factors more aggressively approached than someone else. So genetics is something that you can't change. So you may have inherited the risk of developing heart disease, the risk of developing high blood pressure, the risk of developing diabetes. Those are things that definitely run in families. And it's important to know, and that when your doctor kind of constructs the treatment plan, it's geared towards your individual cluster of risks.
Right.
Diabetes is obviously not a good thing. I know people have had it and have it, and it's not good at all. The key ingredient to finding out about that, would that be just like the glucose test when you do your blood test?
Yeah, there's several ways to make a diagnosis of diabetes. When you have a blood sugar done, just say during the day, you've eaten, it kind of gives a lot of latitude. So it's not my favorite screening test for diabetes. So anything under 200 when you've eaten is considered a normal test. When you go for your annual blood work, or if you go more frequently than that, they usually have you fast. Okay, so not eat, go and have your blood test. So there's specific parameters that a person who does not have diabetes, it would be in that range. There's another parameter that people who have pre-diabetes would be in that range. And then above that would be the diabetes range. The other test that's important, and you may hear more about it, I know a lot of people that are very savvy to this, is called the Hemoglobin A1c. And the nice thing about that test is that you can't cheat. Used to have people that were good as gold 2 days before they went to have their blood drawn and everything looked pretty good. But with a hemoglobin A1c, it is able to measure an average of what your blood sugar's been for the last 2 to 3 months. It has to do with the glucose attaching to the hemoglobin on the blood, on the little blood cell, and those blood cells live 2 to 3 months and they're constantly replaced. So that's how they came up with a way to measure really how you've been doing for the last 2 to 3 months. So if you get through Thanksgiving and Christmas and you go in January and you're told that your hemoglobin A1c is higher than it was, it's probably because of the cookies, the Christmas cookies, all of those things. So it will influence it, but more slowly, so that if you're going to have it repeated, it wouldn't be more frequently than 3 to 6 months apart. But it's a good test.
So what I'm hearing is that like the glucose by itself, and you fasted, that's like when you're on good behavior. It's
It's still helpful to do a fasting blood sugar because there are 3 different ranges for normal, pre-diabetes, and diabetes. So as part of a whole battery of blood work, usually included in that is the hemoglobin A1c. So they'll usually do both.
Right.
It's pretty standard.
Okay.
And then, we keep talking about obviously risk factors, and diabetes certainly being one of them. What else are like the largest risk factors when dealing with some kind of heart issue?
Blood pressure. Management of blood pressure. As I said, when I was talking about stroke, same thing for heart. Long-term, poorly controlled blood pressure can take a toll not only on the acceleration of coronary disease where blockages occur, but also on the heart muscle itself. That if people over time have blood pressure that's not well controlled, like say they go to the doctor, everything's good, they take their medicine, they run out of their medicine, they don't get it refilled, or they eat a lot of, especially, takeout foods are so high in salt that the blood pressure really is not under very good control, that takes a toll on the heart muscle. And the heart muscle is a pump, and the pump can get overworked and can wear out basically, so that they have a weakened heart muscle and they can develop heart failure over time. And heart failure means that the pump is failing and a lot of fluid backs up into the lungs and causes breathing difficulties. Does that make sense?
Yes.
Yeah. What's your view on self-checking blood pressure at home? Like I do it, frankly. I have one of them wrist things.
Yeah. I think it's very helpful. One suggestion would be that when you go to the doctor, bring it with you. That way you take it with your own, they take it with a blood pressure cuff, and you see whether it's very close. There are many products on the market. Most of them are pretty good, and it will alert you at least to something that's really outside of your normal.
And that's what I think is so important with the blood pressure card. At Project Independence, our nurses actually have, that we made up little cards that if a senior comes in or does a home visit or whatever it might be, and they see, once a week, they'll see one of our nurses, there's a little recording card for that reason, to bring to the doctor to kind of see that pattern, which I think is certainly so important.
The doctor will.
No, go ahead. I'm sorry.
The doctor will base treatment on a whole pattern, not a record of one. Oh, my blood pressure, it's high a lot on Mondays when people are eating out over the weekends or taking out over the weekends. We have the outreach bus that goes out and does testing, and Mondays are a bad day. We say, oh God, your blood pressure is so high. What did you eat yesterday? And it's often Mexican food, Chinese food, pizza. Those are very high in sodium. So
you just described my whole weekend.
Well, don't take your blood pressure on a Monday.
That's right.
I have a Fitbit, and one of the things that came out of it that was very interesting is I've been on blood pressure medication for years and cholesterol medication for years. And one of the things that this thing does is it tells you your resting BPM. And you get a report every week that tells you. And mine was running 42, which I was like tired, very tired. And I looked it up and it say, okay, 42 is great if you're a trained athlete.
You're a marathoner. Yeah,
a marathoner. So because of that, I told my doctor, who I mentioned before, and we got into looking at the whole thing from a medication point of view. Why was it down? And I was tired. Part of it is sometimes dehydration, but I was tired. So we changed and actually eliminated one of the three medications I was taking. And now my BPM is around 59, 60, and I feel a lot better. So my point is there's technology that you can use that it's not just a toy. It actually has some valuable contributions that it can make.
They have so many new applications, especially even for more advanced technology like the Apple Watch. The Apple Watch can give you an EKG tracing so that it is picking up atrial fibrillation in people. So it can be very helpful, and there'll be more and more to come. So it's exciting in that way because it can prevent, if somebody has a rapid heart rate and they may need medication adjustment or something may be very wrong. What you mentioned, Otto, is the importance of those doctor visits to review the medications you're on, review how you're feeling, and make the necessary adjustments. It's a lot of times it's tweaking. It's just tweaking the doses. We don't like seniors to have blood pressure that's too low for the obvious risk of falling, because when they're on multiple medications, if somebody is reporting that when they sit up to get out of bed in the morning, they feel very lightheaded, it may be that the time of day that they're taking the blood pressure medication is not synced well to what, their lifestyle. So those are important things to report so that those adjustments can be made. Safety. And with yours, there are certain medications that slow heart rate. Sounds good, but not to the point where it also makes your blood pressure drop so that you feel lightheaded.
Yeah, my diastolic was like down to the floor, and the systolic goes all over the place, but the diastolic was always way down. And frankly, it makes you tired. You're kind of struggling to get through things. I'm the type that forces myself, but a lot of people won't. I think another point, though, out of this little bit right here is that people have to be part of the process of managing their health.
That's what I was just thinking.
If I didn't tell my doctor, and I go there and I don't say anything, nothing's going to happen. They can't read my mind. And I try to talk to people about the need to be a partner in the management. How they say, but they're the doctor. Yeah, well, they're
Yeah.
the
Yeah, well,
doctor,
it's
but
self-advocating in the
well, I
process.
like to liken it to like if a veterinarian has treating a donkey, and the donkey can't talk to the veterinarian. So, okay, so now it's got to be very obvious what's going
Right.
on with this donkey, so the veterinarian knows what to do. Um,
Right.
we're not donkeys, and we can talk to the doctor.
Yeah.
I like that.
Some of that is generational, that people would go to the doctor and just obey whatever the doctor said, which is okay, but your input is just as important. And that was a great point that you made.
Well, the other one is, of course, Dr. Google has a lot to say, and that you have to also take with a grain of salt, sand. Sorry, not salt, with a grain of sand. And like I mentioned in the break, my wife has neuropathy, as do a lot of other people. And if you go online to Dr. Google, there's about 450,000 ways you can treat
Yeah.
neuropathy, and then they all cost a lot. There's the super CBD and the super salt that you can rub your feet in, and all this stuff, and
Yeah.
basically none of it works. So that you have to be careful about who you talk with as Dr. Google.
People are ready to give advice, but they don't always have the depth of understanding to be giving you good advice. That's why you go to a doctor. It's much more complex, many of these issues, to sort out really what's happening and why, not just that you have neuropathy, but why, and then what to do about it. So, the wealth of experience is important, not just
And I think what
reading.
you
'Cause
guys were
people say,
both saying with being, it starts with kind of, and I think about this with all kinds of things, not just heart related, but, being in tune with your own self, because I think there's a lot of times, and there's a lot of seniors that I've dealt with, that might just think, oh, they're just tired, because they're a senior, and they're not realizing that it could be because of one of these medication changes, and I think that Maura, that was such a good point you made, that a lot of times it's just a matter of tweaking something. And Otto, you said you just, just by monitoring, you knew something was kind of off in yourself, and it was just monitoring. It's not always this like major crisis thing that
Right.
needs to happen, and I think that that's why a lot of people are hesitant sometimes to go to the doctor, because they're like, I don't want to get involved in any of this, but it really can be these little things, and it's just so important, because nobody knows what's going on inside yourself more than yourself,
Right.
so to have that initial thing, and these different applications, certainly are good, helpers, but it's really a partnership between you and your doctor to kind of, narrow
Yeah, I had another personal situation because of cholesterol. Take statins and Zetia,
down.
and taking it for years. And all of a sudden, like in the last year, my shoulder started to hurt. This joint started to hurt, and I had heard once before that statins can impact joints and aches and pains. So I go to Dr. Google, and I confirm that's the case. All right, and I talked to my doctor, and we cut the medication, the cholesterol medication, in half. And I know, frankly, my shoulders no longer hurt, and my joints no longer hurt.
Yeah.
What I have to look at is I'll get a blood test next month to see, well, how did the cholesterol hold up under that? Because my numbers have been very, very good, and we want to keep them very good. But there's a trade-off. So again, it comes down to communicating with the doctor about it and being a partner. If I wasn't such a busybody about this stuff, it wouldn't happen.
Right. No, you're the kind of patient that a lot of doctors would love to have.
Well, that's what we always say, Maura. If everyone could just be like Otto, we'd
it's looking at patterns and looking at and not brushing everything off to age, that sometimes there's something fixable, so that's it's a great example, being your own advocate, but looking at patterns and trends and what's getting worse over time. And those are the things that you need to communicate to your doctor. Yeah.
See, now I have one. I'm sorry, but yesterday I went with two of my grandsons to this golf thing over here where you play golf with a screen, a simulator. So we play golf with the simulator, and I'm halfway decent golfer, but I'm getting older. So they're hitting the ball and they're smacking the, what out of it, and it's and the machine tells you it went 200 and whatever yards. I'm hitting the ball and it's going 150 yards, and I'm saying to myself, "What's wrong with this picture?" All of a sudden, I'm not hitting the ball as far. I believe that there are some things you do have to give in on age that are real. All right, I'm not going to hit the ball as far as I did when I was 50 or 40. Right. But there are some things, as you point out, that just because you're aging, you don't have to give into it. I'm not going to go out lifting weights so that I can start hitting the ball as far as I used to.
I had a neighbor. He lived on my block, and he used to like to go to the pool in the summer and walk laps. And I'd see him going back and forth and back and forth. So one time, I said, "Willie, how many laps do you do?" He said, "Well, I used to do 60, but I'm getting tired." He was 90 years old. But now I just do 30. I said, "Well, I think that's pretty good."
And on that note, we got to take another quick break. We will be back with Project Independence and You, talking about all things heart health. We'll be right back.
WCWP is your home for great music and great conversation. You'll find all that and more on WCWP.org. Listen live on the web, check out the lineup, subscribe to podcasts, and stay up to date on the latest station events. Get in touch with us and let us know if you like what you're hearing. And find out how you can support or get involved at the only community public radio station serving Nassau's North Shore. Plus, sign up to get a free bumper sticker. It's all online at WCWP.org.
And welcome back to Project Independence and You on Community Talk Radio on 88.1 FM and WCWP.org. I'm Kristina Lou, your host for the day, here with my co-host Otto Lohse, and we are talking with Maura Calio from St. Francis Hospital, diving into all kinds of things involving heart health. You always hear, Maura, about, as you had mentioned, that there's even a whole special day focusing on women's heart health. And so what are the differences and things to look at between men and women involving this?
Women's hearts are different than men's. And
well, I've been saying that.
When I went to
that's probably
big
true.
Difference. When I went to nursing school many years ago, all of the research that came out about heart disease, the only subjects were men. So that the information that they got was very useful, but it really wasn't applicable to women. And they came to know that over time. So now there are many more research studies involving women, and they've come to find out that really heart disease can manifest differently. It can take a different course in women and men. Men tend to develop heart disease at a younger age. Women have the protection of estrogen until they go through menopause. So women actually, after menopause, 10 to 15 years later than some men develop heart disease, more women have heart attacks than men. And that's something that people don't realize. I did a whole, a talk for some like libraries and things on Go Red for Women. And I searched the internet for videos of television representation of heart attacks. Every single one of them was a man. And it was
I was literally just thinking that, Maura. I'm sitting here, I'm thinking it's always a man.
The elephant sitting on my chest, they sweat, they call 911. Women, it can be more subtle. They might have those symptoms where they have heavy chest pressure radiating down the left arm, but sometimes they appear to have more indigestion, nausea, and vomiting. They may feel like they're getting the flu. The symptoms may go away and come back. And the key is, if this is something you have never experienced before and you really don't feel well, you go to the hospital, because oftentimes women will say, "I don't have time for this. I'm not going to go. I don't want to be embarrassed. I don't want to get there and them tell me nothing's wrong." When there may be something wrong. So symptoms can be different. And again, 10 to 15 years after men have heart attacks, more women than men have heart attacks.
Those symptoms you described are indigestion, nausea, vomiting, are symptoms that people get for other things.
Yes.
Maybe you ate the wrong food, or you have
Reflux.
some digestive, acid reflux, or you have other problems, and that could throw you off, I think, as a woman or
So
a man, frankly.
the difference would be if you have had those symptoms before and had them looked into, and you know what to do for it, do that. If it's something that comes on and you're like, this is not my usual. Obviously you had a big meal, you go to bed, you don't sit up for 2 hours, and you have indigestion. That's one thing. But the other is, this is women describe absolutely not feeling well, and they can't always put their finger on it.
Right.
Okay.
What about sometimes, like if you walk, like I walk a fair amount. And if you hadn't walked for a couple of days or whatever, and it's a little nippy out, in the beginning, sometimes there's like it's not really a tightness, but a feeling like when I was a kid, you played basketball and you'd run up and down and it would hurt for a while and then it would go away. Is some of that normal? I know that's a broad statement, but
it is a broad statement. So I'll try to answer as specifically as I can. Some people have what's called stable angina or angina, depending on how your doctor pronounces it, which means that with a certain level of activity, they might have a little discomfort. They take medication like nitroglycerin and it goes away. When that, say it's 2 flights of stairs, when that activity tolerance decreases, meaning they can only go up half a flight of stairs all of a sudden before the symptoms come on and they get short of breath, that is called unstable angina and may be signifying that that person's heading for a heart attack. So it's a change in the level of activity tolerance. That's a warning. And so cold weather is tricky because what cold does is it constricts the vessels that go to the heart. It's why we tell people over a certain age not to be shoveling snow, okay? Because every time we have a snowstorm, in the paper the next day is the people who had a heart attack while they were shoveling snow. So some of it has to do with cold. They don't really understand exactly what leads to those snow-induced heart attacks, but they believe that it has something to do with the cold and the lifting, the changes of pressure in the chest. But as far as somebody's normal activity, if the symptoms are coming on sooner, that's something that you need to get checked out.
Right. Okay.
It's hard to know whether that
goes back to, paying attention to yourself, as you were saying, more, you can't, it's not necessarily this blanket statement, because it really is something that, everyone I think has had that feeling like this feels not like something I've kind of dealt with before, and I think it's so important to be in tune with that. And,
I'm sorry, I'm jumping to a quick different track here because I want to make sure. There's a blood test that was talked about in your material, I think. BNP. What is BNP?
Sure.
No?
I don't know.
Okay.
Are you sure? There's a couple of markers that are done that highlight.
Maybe I got the initials wrong.
I think so.
Something
I think it's there's a few that are done as markers to highlight inflammation, which is thought to have a role in the development of heart disease. That may be what you're talking about, but I'm not sure.
Yeah. Okay.
More going into like the, having, obviously we talk about the risk factors and stuff. And, what I always like, if you do get into this, what are, like, if your heart has been damaged or is running slower or tired, are there ways to kind of get it back up, and kind of rebuild the health of it, or?
Well, that's what cardiac rehab programs are all about. I mean, we have one here. There are many. So if anybody's asking me, I'd say go to something that's convenient to your house. But what those programs help with is everybody has a stress test before they begin the program, whether they've had a heart attack, whether they've had bypass surgery, whether they have cardiomyopathy where the muscle is weak. They have a baseline test done, and then a specific plan is put in place for that person. And they come to a program like that 3 times a week, and they're on a heart monitor. They have their blood pressure taken. And the nice thing about that is people are often afraid to exercise after a cardiac event of any kind. This helps them become more aware, to learn how to exercise safely and be monitored while they're doing it, at least for a few months' time. Then they go on what's called maintenance, where they're given specific routine to follow once they don't come to the program anymore. So those can be very good especially in somebody who's been sedentary and then has a cardiac event, somebody who's so fearful of getting back to exercising, and somebody who needs their activity tolerance improved because they haven't been doing much of anything. So they're very good programs.
That's at the DeMatteis Center?
We have one here at the DeMatteis Center. Yes, it's a very
Right.
big program. Yeah.
Right.
And then with, certainly I think everyone can see when they see heart health stuff, it's a lot of diet and exercise. So what are like the main foods, that can help, with heart health and reduce your risk factors and whatnot?
Watching how much animal fat is in your diet. I know especially seniors are used to eating meat. So you just be careful of the types of meat that you choose, and more fish. Fish is a very good addition to your diet. How you cook things makes a difference. Getting away from frying things in a pan. It's easy to do, but it's not really the healthiest because of the types of fats that you're consuming, and the most fruits and vegetables that you can fit in. Seniors have to really watch salt as well, which we've mentioned because of the blood pressure control issue.
With an air fryer, you can put stuff in without the oil.
Yep.
Like French fries, actually.
Yep.
Um,
Because those
that
are
tastes pretty
frozen. Frozen French fries are really baked, so they're healthier than takeout French fries. Yeah.
Right.
That's good to know. It's a fun little golden nugget.
I have become very much more. My son bought me an air fryer, not this past Christmas, and the year before, and I said, "Oh, great, another appliance that I have to pay
Yes.
for." And he said, "You'll see." And I really have.
It's true.
It's easy to find recipes and how to cook. You just do go online and put in air fryer carrots, air fryer asparagus, air fryer fish, and it's easy to follow. So it is a good appliance, and it's safe too. It's not like you have
Maura, it's so funny. We talk about the air fryer a lot on the show. Somehow it always goes back to the air fryer. Otto and I have had a lot of air fryer topics because it really is something that I think is actually, as you had mentioned too, what I like, it's healthier. Plus it's easy and it's safer. So it's a good option for a senior, and they make so many different ones. You don't need some kind of ginormous one, but I think that it really is good, and it's tasty, so I use it all the time. So I love doing, vegetables in there because it gives you that nice, like roasted taste, without all the oil and everything.
I got 2 things. One is maybe you could give a suggestion on fish in an air fryer. And the second one is the problem I find with an air fryer is there's not enough room to do everything. Like if you want to have French fries and you want to have fish, you can't do them both in the air fryer.
Right. Yeah.
And that's
I told you, mine, I have
you
the
need 2
drawer
air
one.
fryers.
So I have which actually might be
drawers.
because I got the 2 drawers. So you could have in one drawer, your vegetables, and in the other drawer can be, your meat or whatever.
How do you do fish in an air fryer?
I haven't. I usually bake fish in the oven.
Yes.
Because I have a whole family to cook for. So I can't really give you advice on that.
I know,
Okay.
that's Otto. I'm actually going to dive because it's funny because I normally do fish. I bake it also because it's more, I'll just give it for my parents and my husband. So it's hard, in the air fryer. That's my only thing is that you can't really do a bulk kind of meal in the air fryer. But it's really good for someone that if it is just two people in the house or you're by yourself, I think that's why it's really good for a lot of seniors who, want to have, a meal thing, but it's,
Right. And you're not dealing with flame on the stove and it's fast. So you don't have to, if you need to stand up and wait for it, it's, you can reheat in just a few minutes.
How about eggs?
I haven't done eggs in the air fryer.
No, I don't mean in the air fryer, but I'm
to
saying,
eat eggs.
generally eggs have
eggs-
been, bad, good, whatever over the years.
Yeah, no, that's a good question.
I had a teacher when I was in nursing school, again, a long, long time ago, who was very upset that eggs got such a bad rap because they are very good nutritionally. They're a good source of protein. So I would say that, eggs a few times a week is fine. If you're scrambling them, I add a lot of egg white because egg white doesn't have the yolk, doesn't have the cholesterol. And you can make a very nice sized omelet or scrambled eggs, even in a mug with egg whites. So if your doctor's cautioned you against a certain number of eggs per week, egg whites is a great alternative. You can add vegetables to it. You can add seasonings that don't have salt, and it can be a meal.
I
Well,
love
we were
egg
at
white.
a diner
I
yesterday,
do.
and I had a garden omelet with home fries. So I'm sure there was some bad stuff mixed in the middle of that whole thing. The
But what I think
vegetables
also
was
it's
the good part.
portions because I love. It's funny because it's we were just having this conversation at work, about eggs, whole eggs versus egg whites, and I was saying a lot of times I prefer the egg white. I just find it's not as heavy a lot of times for myself, and it's easier on my stomach, and I love vegetables. A Greek omelet is like my favorite thing in the world.
Yeah.
It's tasty and it's satisfying.
Mhm.
But Otto, I am a fan of a home fry, but I think it's all portion. No one's saying you have to never have a home fry, but maybe just, not eat the entire portion of the home fries.
I had the whole portion.
And if it's once in a while, it shouldn't be a
Right.
daily way of eating. Some people go to the diner every morning for breakfast and order, high fat meals and all those things. So obviously a daily thing is not a good idea, but you can't be good 100% of the time. If
That's a
somebody
good
has serious problems with sodium and heart failure, I can't comment on that. You have to really toe the line. But, a taste of something once in a while or a little bit of something that's a treat is, kind of keeps you going.
Well,
know.
sodium is one that I see people, they get a meal and immediately the salt is on the meal before they
Right.
even
Before they
taste
even
it.
taste it.
Or frankly, I have a granddaughter. She puts ketchup on everything right away, which is
Yeah.
loaded with salt. And, as a nagging grandfather, I can only joke about it, but she goes through a lot of ketchup. And
Yeah.
I don't think that's a good thing. And, she's
Yeah.
young and
Yeah.
that's not going to help as she gets older.
Right. It'd be hard to make adjustments
I
as she
think
gets
so.
older
I
when
mean, you're
she's
eating
told
ketchup,
too much salt.
basically.
Yeah.
Yeah.
No, but I
I
think
believe
that's
salt
the
ruins
point.
the taste of the food, frankly. If you put too much salt on anything, it's just eating salt.
Yeah.
No, but and I think that's important, and obviously our show is geared towards seniors, but we've really become more of a community show, and these are things that I think are so important for any age because as you both just said, starting to make healthier choices at a younger age or be aware of certain things. Obviously, you don't have to be as drastic. You can kind of get away with a little more when you're younger. But it's so important because when you do get to that age, number one, you're lowering your risk factors to begin with, and then when you have to make certain modifications as you get older, it's not as, drastic because that's what gets harder. And I think that makes a lot of people kind of turned off to not even wanting to deal with it or face it, so.
Right.
I think there's little tiny, we're all about too on the show. It's just like these little tiny little golden nuggets, we call them, that you could kind of implement in your life that, helps you out. But oh my gosh, we are at the end. I think we've jam-packed. Maura, you're always a fabulous guest with so much information. We'll have to have you back on.
Thank you for having me. Yeah.
More of these topics. So everyone, just remember it's Heart Health Month. Keep these golden nuggets in mind. Thank you again, Maura. This is Project Independence and You, Community Talk Radio, here on 80.1 FM and WCWP.org.